How do you go from this to this? Let's talk about it. This lovely 23-year-old patient came to us after she lost 60 pounds with diet and exercise. She's not had any kids, and yet she experienced some drooping of the breast after the weight loss. She desired to lift the breast and to achieve more volume at the top. This is how we did it. So here we are preoperatively, and you can tell that the patient has had some loss of volume up at the top of the breast. You can see the edge of her pec muscle coming in here, and this shadow here, and this hollowing with the breast tissue is hanging down. You can tell that the nipple and areola is kind of around near the bottom of the breast, so significant amount of nipple ptosis, but likely also a fair amount of glandular ptosis, which is the breast tissue overhanging the breast fold. There's some asymmetry between the volume and the position of the breast between her two sides. She desired to lift the breast, right, which will help us lift the nipple back up onto the mound and achieve more upper pole fullness. And so you can see the shadow now has been erased. There's volume here now. You can see that we've improved her cleavage, so her breasts are closer together. And there's better overall symmetry and volume. Now, since she's going and starting with more volume than the average patient, meaning she's probably at kind of a D cup breast at baseline, and she wants to go to a final volume that's around a D or a small double D, that means then when we add an implant, we're going to have to subtract out some of the breast tissue, right? So if she's starting at a D, she wants to be similar or slightly larger, and we're adding the implant, then some of the volume has to come off the breast. And so technically, this is not just a lift, it's also a breast reduction, okay? So making the breast smaller while lifting it, and then replacing some of that volume with an implant, which will give the final breast shape more of an implant look. So let's see that as we go to the next image here. So again, you can see this hollowing and flattening at the top of the breast as it transitions from the pec to the droopy breast tissue. You can see the amount of overhang that we have here, how the breast looks a little too wide for her chest as it's sliding down and out along her rib cage. We can see that we've dramatically improved that and given her more of a definitive side boob and much more projection. And here she is with her arms raised, and she's going to show animation deformity. Again, just shows that the breasts change as they normally would with movement. And that's how we did it for this patient. If you're interested in rejuvenating your breasts, give us a call or come visit us at almoplasticsurgery.com.